Yeah, hello. I've lived in Ashford for 30 years, had 2 children born in the William Harvey Hospital and attended the hospital for all various things that you do. We have members here in the audience from Czech, and I know that they will be heavily campaigning for option 2 for all of the services to be going to Canterbury. And of course you've heard from the MP for Ashford, it would be political suicide for him not to campaign to keep the services here in Ashford. I'm here tonight as part of Save Our NHS in Kent. We're concerned with the whole of East Kent, well the whole of Kent, but we're campaigning at the moment in East Kent. Our demands are that there would be a third option, because going forward, if we're going to improve services, and that's what we're looking at here, not what we've got at the moment, we want to improve. And the improvement can only be if everybody can actually get to emergency care within the required time. I've got something that I'd like to deliver. It is a listening event, so I hope you'll bear with me and give me the opportunity to deliver this. So
just checking, is that a speech that you've got written, or some points you've got written down on paper?
It's points that I need to address about why we're asking for a third option. As I say, this is a listening event. You're supposed to listen to the people
and we
here.
Did are.
Okay. So the reasons you're saying why we can't have a third option and we can't have 3 A&Es to cover the whole population of East Kent. Okay, so you're saying that there's not been an A&E since 2002, but there was an urgent care centre until June 2017.
In Canterbury. Emergency.
Sorry, at Canterbury. This closed temporarily without consultation and hasn't reopened. The population of Canterbury are obviously unhappy about the loss of A&E and consultant-led maternity there. Just because there hasn't been a full A&E doesn't mean there shouldn't be one now. The population is growing in every corner of Kent, and so is demand for healthcare. People cannot be expected to travel for anywhere between 30 minutes and an hour for emergency life-saving services. Blue-lighted vehicles cannot be guaranteed to negotiate East Kent's narrow and often blocked country roads in a reasonable timescale. No one should have to battle the roads while they battle for their life. Point 2 that they will tell you here is that there's been reports by the Senate, Government and Department of Health that say there can't be more than 2 full A&Es here, although they're still not offering 2 full A&Es of these options. These recommendations were drawn up in 2013, they were shelved in 2014 due to their unpopularity in the general election year. The proposals being prepared today, been presented here today, and presented very well, giving the old razzle-dazzle is what I would say. The proposals being presented today are a result of national planning, not local need. They're being forced through region by region, taking no account for their geography and demographic needs. It's a target-driven, top-down reorganisation based on our hypotheses. Highly paid managers are peddling the case for these changes, regardless of the risk or any evidence of improved outcomes. These reports that they talk about are based on a study of London hospitals in 2010. However, it's been clearly established that those findings are not applicable to the mixed rural area of East Kent. Our distances and therefore our journey times are much longer. There have since been 2 more studies proving no improvements to patient outcomes from centralising emergency services, and mortality rates actually increased with the distance required to travel.
Nearly there?
Nearly there, bear with me. Okay, the next thing they tell you is about staffing and recruitment issues. As the Stroke Association very clearly have stated, and they do state this, staffing should never be used as an excuse for closing hospital services. You've not supplied sufficient evidence that specialist staff cannot be recruited locally, and we have yet to hear about real incentives being offered to attract staff. The cost of centralising services, as is proposed in option 1 and option 2, as you've said yourself, will run into many hundreds of millions of pounds. Would it not be better to use that money to offer incentives and get the required staff? If recruitment difficulties are as bad as to be unsustainable, shouldn't the NHS managers be taking the situation to Parliament as a matter of urgency, rather than being complicit in managing the decline of the NHS? We are told this is a national crisis, so the NHS managers in this room should be pressing the government to address this right now. They should not be promoting unproven models of care with dangerous journey times. Save Our NHS in Kent have been investigating the reality of staffing in Kent. The area with the least difficulty in attracting specialist staff is London. Area with the second less difficulty is Kent, Surrey and Sussex. As we're in a better position than most of the country, It begs the question, are the staffing difficulties being exaggerated to justify the cuts? In summary, consultants should not take options off the table in the way that consultation should not take options off the table in the way that you have. A third option with 3 A&Es in Kent's 3 hospitals must be included. The public consultation documents next year should include an honest assessment and scrutiny with the pros and cons clearly stated for each of the 3 options. Without a third option, the residents of East Kent are being offered a Hobson's choice. A consultation where the only option is centralisation is not a genuine consultation and will leave you open to a judicial review. These are supposed to be listening events, so listen to this. So far, over 2,300 people have signed a petition demanding a third option for 4 A&Es at each hospital to be added to the consultation next year. Plus, most of the people that have attended tonight have also signed this petition. That is far in excess of the number of people who have attended your listening events or will attend your listening events. So if you're really listening, include the third option.